CHARGE syndrome or Hall-Hittner syndrome. So we will see what is CHARGE syndrome, its etiology, pathophysiology, evaluation and management plans. This is Ruben Dodd, a 15-year-old actor suffering from CHARGE syndrome. So CHARGE syndrome is a rare autosomal dominant genetic disorder, and the C stands for coloboma, H for heart defects, A for atresia of the choana, R retarded growth, G genital anomalies which are more common in males than in females, and ear anomalies. Endoscopic picture of choanal atresia, and this atresia may be membranous or bony, unilateral or bilateral. Ear abnormalities include classical findings of unusually shaped ear and a hearing loss which can be mild to severe deafness, both conductive and sensory neural type can happen. So the CHARGE syndrome, C for coloboma, H heart defects, A for atresia of choana, R retarded growth, G genital anomalies and E ear abnormalities. And what is the etiology? Mutations in the CHD7 gene is the most common cause of CHARGE syndrome. Anomalies of the neural crust derived tissue can cause this. The 3C triad, coloboma, choanal atresia and abnormal semicircular canal, as proposed by Blake et al., further modified by Verlos. Or there can be major criteria of 4 C's, coloboma, cranial nerve anomalies, choanal atresia and the typical CHARGE ear, and the minor criteria are heart defects, cleft lip or palate, genital abnormalities, hypotonia, kidney abnormalities, esophageal atresia, poor growth, typical CHARGE face and typical CHARGE hand. Evaluation of CHARGE suspected patient is important. One is clinical diagnosis, a combination of major and minor diagnostic criteria having 3 primary features or 4 major and 3 minor characters. Laboratory analysis including a blood workup, complete blood count, serum electrolytes, renal function test, luteinizing hormone releasing hormone assay, then HCG, that is human chorionic gonadotropin assay, etc. Genetic analysis, that is the prenatal screening for CHD7 variant via an amniocentesis, the chorionic or villus sampling at 10 to 12 weeks and also 18 to 20 weeks of gestation. And also imaging studies involving including a skeletal survey, abdominal ultrasound, barium solo, echocardiography, chest x-ray, then CT scan and also MRI. The CHARGE syndrome patient needs a careful medical as well as surgical management. Strategies depend upon timing, features and severity of presentation. The most common neonatal emergencies include cyanosis due to congenital heart defects and also bilateral choanal atresia. Emergency management of respiratory obstruction requires only an oral airway, but definitive management is a surgical approach, and surgical approach of choice is transnasal endoscopic repair of the choanal atresia. And the children need a multidisciplinary follow-up, hearing rehabilitation with hearing aids or early cochlear implantation is needed, behavioral and pharmacological intervention and also genetic counseling should also be given. So that is regarding CHARGE syndrome.